Views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Get involved with Access Fort Wayne and make your own television programming. Call 421-1250 to find out more.
So you wanna be a doctor? Well, they're getting there is slow. A whole lot of school to learn the things you gotta know. Well, get ready, everybody. This lesson's for you about the bones in your body and the things they can do. You need to know where they go and how they connect, so you and your body have mutual respect. We're going to call on our friend, the skeleton, and name these bones one by one.
We got the foot bones. Connect the shin bones. Connect the thigh bones. Connect the hip bones.
Now what we've got here is the lower half of the body, beautiful, and that's no laugh. The other bones of the body we need you see, 'cause put together neatly they make you and me.
Celebrate good times, come on. Celebrate good times, come on.
There's a party going on right here, a celebration to last throughout the years.
So bring your good times and your laughter too. We gon' celebrate your party with you. Come on. Celebration.
Let's all celebrate and have a good time.
Celebration.
We're gonna celebrate and have a good time. It's time to come together. It's up to you. What's your pleasure?
Everyone around the world, come on.
It's your celebration.
Celebrate good times, come on. Celebrate good times, come on.
There's a party going on right here, a celebration to last throughout the years.
So bring your good times and your laughter too.
We gon' celebrate your party with you. Come on now.
Happy 10-year anniversary to Wesley's TV.
Your anniversary, Wesley TV. Happy 10-year anniversary.
First, celebrating National Health Center Week as one local organization works to expand healthcare in underserved areas. Your number one news at 11 continues.
Neighborhood Health Party was a celebration of National Health Center Week. Neighborhood Health says this week's purpose is to highlight the community impact access to healthcare centers that make it at the neighborhood level. Today's party was at the Oxford location.
We just opened this particular location last year, but even before we opened, we were doing block parties in the neighborhood because one of the most important things about our health center is relationships, civilian relationships with the community.
This was Neighborhood Health's 5th annual block party. Nicholas.
Yeah, good weather for that. You can see it with everybody outside. More sunshine.
Turn it out. To the left.
No.
Now, y'all.
He always comes to
this
this
time. Right foot, let's stop. Left foot, let's stop. Right foot again. Left foot again. Right foot, let's stop.
Chubby waist, 6 legs in shape, rump shaking both ways, make you do a double take. A showstopper, flow, pop ahead, like a beat scholar.
And I think we got a fan.
Thank you.
There we go.
That's
We'll do the fan first. All right, this is for the fan. He's gonna need a slushie though. All right, a fan. First person, we got Carlos. We got one more, okay. For a nice fan provided to you by United Healthcare. Halima. No. There we go. She got a fan to go with her umbrella. This is for the gas card. No? Alright, we gotta get past the next one. Gas card goes to Wilson. Wilson.
Yes, sir. Yes, sir.
Something low. That's fine. got my camera at home. Let's take some B-roll.
Okay, how often do you feel you lack companionship? Hardly ever, often, some of the time.
Trying to make sure that we cultivate good relationships while the kids are down
You want a duck or a wife?
What is the duck piece?
So it's like for your lunchbox. It gets super cold in the freezer, or you can use it as like a hot pack.
Oh, okay. I would take one.
Yeah, of course.
Thank you.
You're no problem.
I have a dentist that was not really helping me when I needed help. So I was like, where am I going to go for dental? That's when I was like, wait, what about neighborhood health downtown? Then that's when I came and seen Dr. Brown, and he kind of set me on my way. Everything that was not fit. Everybody here has been understanding and all hopeful. They explain to you what's going on, and when you need something, they kind of get you in the same day. When I came to the Occupational location, there's all these Cecily things for people to like help calm down. Which they kind of make me feel calm too. Even without autism, it's still, I think it's for everything, anybody with any kind of special needs. I like the whites. And in the National Dental Room, I like the little bubbles you guys start, because they will work with you for your salary and stuff. Because I sometimes get nervous with dental stuff too. What it is my old dentist, he would just force things in. And they just force their way in, and they are not patient. But with Dr. Campbell and Dr. Brown and everybody here, they are real comforting, and they explain to you what's going on for the process, and they don't rush through it. And they do what you ask, they use what actually works for you.
Hi everybody, this is Wesley's TV. I'm Rose, and this is Dr.
Tyler Kimmel.
There we go. And what is your job and what do you like to do?
So I'm a dentist with Neighborhood Health, and we've been working lately on trying to increase access to care for patients with disabilities. So you can see some of our sensory items here that we work on, weighted blankets, noise-canceling headphones, tiles, and things like that. Just things that can help people to feel more comfortable during their dental visits.
All right. How long have you been a dentist?
13 years already.
Oh, wow.
Wow, it flies by when you're having fun, right?
Oh, yeah, it does. All righty. This is Rose letting you know we talked to the doc. We're going to head somewhere else to get you more information. Y'all have a good day, and I'll see you later.
Makes me upset. It gets me upset. Even sometimes when people make fun of me, it gets me upset. That's the thing a lot of people don't understand. Even the hospitals don't understand this. There's certain things she can't help. And there's not that many people that want to handle that kind of stuff in town. So when she came here to Neighborhood Health to see Dr. Campbell, she was sweet as a pie. I'm like, okay. He did something that I don't know what he did, but he's a massive worker with people with autism. So people sometimes don't understand the needs of that kind of people. You guys work with everybody. And you guys get out there and do stuff for people. It wasn't for you guys. I don't know what some people went to. Because she's been looking for dentists for her daughters. She's like, I don't know where to take them. Nobody wants to deal with them. Because there's really nobody in town that really wants to deal with people with autism. So you guys are like making it to people with autism, that's why tend to help.
morning, everyone. Thank you so much for being here and welcome to the Urban League. I am Lisa Bergeron. I'm a developmental pediatrician at Alliance, and I came to Alliance with over 30 years of experience in general and developmental pediatrics. I chose developmental pediatrics because it really is the heart of pediatrics. And my vision since I was in my fellowship has always been to set up a multidisciplinary team to evaluate and help children and families. As a native of Fort Wayne, this is just an exciting time to be a part of Alliance Health Centers and what Fort Wayne has to offer. We will be able to offer that multidisciplinary approach that I've been dreaming of for so many years. We're going to be there to help families and children with developmental issues and other issues as well. We will have the opportunity to offer a variety of services, especially the pediatric specialty services with speech and language therapy, occupational therapy, and physical therapy. And together we will provide those early intervention therapies for those children and families in need. It is a proven fact that early intervention makes a huge difference in the lives of children and family in their future success. We will also offer those diagnostic services for the evaluation of autism, which, as we all know, there's definitely been an increase in the number of kids that we've been seeing. And those kids and families, we're going to be able to provide them with the help that they need to get those resources that they so desperately need so that their children can be successful in the future as well. And how thrilling is it to be a part of this team, all under one roof. We are so passionate about serving this community. And in 2025, Alliance began working with the Fort Wayne Urban League to really identify the biggest gap for services for children in our community. And this clinic is the result of those partnerships, many meetings, and collecting of lots and lots of data. I want to give a great big thank you to WindSwell and their generous grant that really supported this clinic, the Fort Wayne Urban League, and all of our community partners who have helped to put this together. So a great big thank you so very much. And now I'd like to introduce Mayor Sharon Tucker. We're pleased to have you here today.
Thank you. You know, I always tell people that we have construction going on because it shows your tax dollars working until it catches me. And then I'm like, oh man, our tax dollars are working. So I thank you so much. I am so happy to celebrate access to health care. For many years, our community, Southeast Fort Wayne, has had multiple gaps. Access to health care, access to healthy food, and we've been working diligently as a collective group, as a community, to be able to address all of those gaps. And so having Alliance Health be able to provide a service to our community is vital. But it's even more important because of the work that they're going to be doing, the kind of service. Rarely in this area do you have someone that can do developmental diagnoses. Rarely in this area. And so being able to identify when a child needs some care is vital, especially at the young ages, so that they can get the care that they need to be able to help set them on a better quality of life. And so I'm thankful that we have partners that are willing to come alongside of us, the Urban League, Alliance Health, the board members that are here, WindSwell, to fill those gaps so that we can give our children the best head start that they can have. And even for some of our adults, because we do have adults that haven't been diagnosed as well. So having access to healthcare in this community is vital, and we're glad that we have partners that have come on alongside of us to be able, hi Nikki, to be able to close that gap and give the care that we know every resident in the city of Fort Wayne deserves. Thank you all so much.
Bill GiaQuinta, State Rep for District 80 and a board member of Alliance. A couple things, and then I want to for sure make sure our board chair, you'll do a lot of this talking with regards to the board members, but I do want to recognize the board members that are here can kind of wave their hand. Joe, I see you, Thomas, everybody else. They do a wonderful job on the board. We meet once a month, and you know, when I first started this, I think almost 6 years ago, Sharon, I think you were there with me too, that it was this, kind of the startup over at Lafayette Medical Center, and startups are kind of difficult to do. There's a lot of things you have to get through to expand the services that you want to see here in Fort Wayne, Allen County, and the region. And then when you go on our website today, and it shows, I think, 5 clinics in addition to Lafayette Medical Center. This will be number 6. Now we're in Marion, Indiana, Auburn, Logansport, and really doing a wonderful job providing care to the community. The reason I wanted to get on this board early on was to, as you mentioned, with regards to the rankings and where we were with regard to infant mortality and all those things. Not only just, I think 46803 had one of the worst, that zip code had one of the worst rankings in the state of Indiana when it came to healthcare services for our folks here in Fort Wayne. And I think we're doing a really great job, frankly, of providing these services, again, not only here but around the region. From a state representative perspective, as you all, you read the newspapers, you see how money is becoming tighter and tighter. Services are also becoming hard to get. And while I used to represent this area up until 2020-21. When it comes to healthcare, there are no boundary lines. All folks need help. And we're just really happy. I'm particularly happy that the Urban League now, and I do want to thank Aisha Arrington with the Urban League. Also, I'll give another shout out to Patti Hayes with WindSwell for her obviously generous contribution to make this work. Also wanted Nikki King is a rock star doing a great job. She really pushes the board. Maybe a little too much, but we're okay. We're doing great things. So thank you to everyone for being out here today. Good luck here at the Urban League, Nikki. You're going to do a great thing. So with that, I'm going to introduce Patti. Patti, come on.
I typically don't read, but I'm going to today because the message is so important. First off, thank you. The rebranding has worked. Everybody said WindSwell, not a prior name, which I'm not going to say. For those of you who I may not have had a chance to meet, I'm a nurse, and I say that very proudly. And any nurse will tell you that early detection will optimize outcomes on any issue. And WindSwell Foundation is going to drive that home here by our partnership. The space that's been constructed is providing much needed support close at home for that early detection and intervention. Already there has been discussion around the healthcare services that are going to be here, but key is this clinic is going to facilitate early detection of delays and the needs that are there for children that are not hitting their developmental milestones, to allow that critical early intervention that will optimize that child's readiness for school, performance in life, and ultimately what we all want for each of us to be a productive, contributing member of our community. Fort Wayne and the state of Indiana needs the workforce to contribute to our future growth, and that readiness starts with programs just like this. Providing these services with partnerships like Alliance and the Urban League at this location where transportation is less of an issue because the services are within the community is a critical part, not just for the diagnosis, but for that ongoing intervention of the services that Dr. Bergeron highlighted. These dollars invested in that early detection will end up saving money, because with that early intervention we will see better outcomes. We may see less ER visits. We may see less expensive interventions that come without that early intervention. But just as important as that identification and early intervention is the security of the safety net of coverage. We haven't yet talked about Medicaid and what is happening in our state with the number of kids that are not getting the Medicaid coverage that's necessary. We need to limit denials of renewals and expedite approval of the medical waivers that these kids will be waiting to receive. It can be a complex process, but the earlier the identification, then the earlier the intervention, and that happens when the brain is most receptive, and we will get the best outcomes. The infants and children receiving services in this space are being provided with vital, quality services that will maximize their independence, will maximize their learning, and will maximize their community integration that every Hoosier child deserves. It's a vital service, and I thank you, Nikki, for inviting us to join you and Dr. Bergeron with critical services. Everybody knows Aisha, but I get the job of saying the floor is yours.
I will have to read notes. Okay. Thank you all for being here today and for taking the time to join us as we celebrate the ribbon cutting of the new Alliance Health Clinic that's going to be housed here at your Fort Wayne Urban League. This project is especially meaningful to me because I know firsthand how important early support and access to care can be for families. I once knew a young mother who gave birth to a healthy, beautiful baby boy. As he grew, she began to notice that he struggled in daycare, at school, and in social settings. At just 6 years old, doctors diagnosed him with ADHD and medication was prescribed. Desperate to help her son and keep him in school, his mother followed the recommendations and hoped this would provide the support he needed. But as the years passed, the challenges continued. He was removed from multiple schools, struggled to meet expectations in traditional settings, and his mother knew there was something more happening. She continued advocating for him and seeking answers, but instead of receiving the support and guidance she needed, she often encountered a system that was difficult to navigate and did not provide the help her family needed. It would take until that young man was 15 years old before he received the correct diagnosis: autism. That young man was my son. I share this story because I understand the importance of what this clinic will provide to families who are searching for answers, resources, and support when their children experience developmental delays or challenges. Families should not have to struggle for years to find the right care, and no parent should feel alone while trying to understand how to best support their child. The $400,000 helped make this project possible, represents so much more than funding. It represents access, opportunity, guidance, and hope for families who need it the most. Today is a celebration of what happens when communities invest in children and in families. This clinic will serve as a lifeline for many, providing resources and support that can change the trajectory of a child's life. And if this clinic helps even one child receive the support they need sooner, preventing another family from experiencing the challenges my son and my family faced because of a delayed diagnosis and delayed access to services, then this effort will have been worth it. Thank you to everyone who helped make this vision a reality. Today is a day of hope, it's a day of partnership, and a brighter future for the families we are here to serve. Thank you so much.
Good morning. I want to confess that I made a serious mistake. I told Nikki that I wasn't very busy. And because I told her that, she decided to make me busy. And she asked me to say a few words at this gathering. And as you look at me, I'm sure you're going to make an early diagnosis. I look like a fish out of water. So you're correct. That's the way I feel, like a fish out of water. But I do want to, one of the first things I want to do is echo what most of the other speakers have said. You know, I want to thank Dr. Nikki King and her staff for the hard work to bring this project to fruition. Also, I want to thank WindSwell for their generous donation so we can open this clinic. I want to thank the CEO and president of Fort Wayne Urban League had the foresight to approach the Reliance Health Centers to put a clinic here. So I am very grateful for all these things that people have done so that we all can stand out here and celebrate this great clinic. Now, I want to say a few words about health disparities. I remember reading an article several years ago about, it was talking about the difference between health disparities and health care disparities. And I'll be honest with you, I didn't quite understand the differences then, but as I became on the board of Alliance Health Centers, that was about 5 years ago, and then 2.5 years ago I became the board chair, I began to develop a better understanding about health disparities and health care disparities. Now, health disparities are the difference in health between racial groups. Health care disparities are differences in access to medical care because of socio-economic problems. It's not so important we understand the difference between the two. That's the main thing I have to learn. You have to understand the two are very intertwined. Because you have health care disparities, people that don't have the necessary access to medical care, you have health disparities. And when you have health disparities, you have poor health outcomes. And the sad part of this story is that most of these poor health outcomes are preventable. So that's why I'm so excited about having a clinic like this that will help reduce the health disparities in this community. And I'm going to introduce a couple of providers that have been playing a major role in decreasing health disparities in this community, and we'll continue here with this clinic doing that. I want to introduce Fatima Alexander, who's a midwife.
Good morning, everyone. I do have a soft voice, so can everybody hear me? Yeah, okay, awesome. My name is Fatima Alexander. I'm a certified midwife. And as a midwife, I am used to celebrating new beginnings, but instead of a baby, today it's a healthcare clinic. So I'm super excited to be a part of that process. It is truly an honor to stand here today as we celebrate the partnership between Parkview, Alliance Health, and the Fort Wayne Urban League. A lot of times when people hear the word midwife, they just think about babies and delivering babies and happy moments and things like that. And while it is certainly one of the greatest privileges of the things that I do, midwifery is so much more than that. Sorry, guys. So as certified nurse midwives, we care for women across the lifespan, from a young woman coming in for like her first gynecologic exam, annual well woman exams, postpartum care, all the way through menopause, birth, all of that. So it's total woman care. And we have the privilege of building relationships that often span years, providing evidence-based care, and then also partnering with our patients to feel informed, to feel supported, and empowered to make their own health decisions for themselves and their families. So over the years, midwifery has taught me that caring for women is never just about that one woman. When a woman is healthy, when she's informed, when she's empowered and supported, it actually goes beyond the exam room, it goes beyond the hospital room. It reaches her children, it reaches her children's children, it strengthens her family, it strengthens her community, and it really does have a ripple effect throughout time and also throughout space. And that is the lasting impact of women's health care. It really does shape generations to come. Over the years, also my patients have taught me something, that exceptional health care begins with trust. People want to feel seen, they want to feel heard, they want someone who's listening, but not just to their symptoms, to their goals, to their concerns, to their story, and to help to contribute to reaching all of those goals that they have for themselves and their family. And that is truly what whole woman and whole person care looks like. I found that although evidence guides my care, the relationships that we build give it meaning. Because the people I care for are more than just patients, every person who walks our doors brings a story, they bring a family, and they bring goals for their health. And it's our responsibility to honor that with compassionate, evidence-based care. They're trusting us with their stories, their health, and some of the most important moments of their lives. One of the greatest privileges of being a midwife is actually earning the trust of that patient and their family. The trust that's required for people to feel comfortable actually inviting me into that space, into important moments of their life. That trust is built by listening, it's built by showing up with compassion and providing evidence-based care. We know that there's still important work to do, just as he was talking about health disparities and healthcare disparities. The reality of the maternal and infant mortality and morbidity rate in this country reminds us that access, trust, representation, and high-quality evidence-based care matters. The Urban League has spent generations creating opportunity, strengthening families, and removing barriers within our community. Today, Parkview Health and Alliance Health Centers are honored to join that mission by bringing comprehensive health care to the community, or to the heart of the community. My hope is that every person who walks through these doors feels respected. I hope they feel informed, and I hope they feel empowered. And I hope they know that they have a healthcare team that will walk alongside them, not just for one pregnancy or one chapter of life, but through every season that they trust us to. Because today isn't simply about opening doors of this new healthcare clinic. It's about opening doors to healthier families, stronger communities, and creating healthier futures for generations to come. And I can't think of a better way to celebrate a new beginning than.
My name is Erica Woodward, and I'm a behavioral health clinician and also a supervisor here at Urban League. I will be reading off my notes just to keep me on track. But if I asked everyone in this room whether behavioral health has touched your life or the life of somebody that you know, I imagine nearly every hand would go up. Behavioral health isn't someone else's story, it's actually our story. It's woven into every family, every workplace, and every community represented here today. When people hear behavioral health, they often think of mental illness, and that's certainly part of it, but it's much broader. It's how we think, how we feel, how we respond to stress, how we build relationships, and how our emotional, physical, and social well-being work together to shape a meaningful life. The World Health Organization reminds us that there is no health without mental health. I'd add that there's no thriving community without behavioral health. As a clinical social worker, I have the privilege of walking alongside people during some of the most vulnerable times of their life. Parents balancing work and family, young people navigating anxiety, veterans returning home, older adults facing grief, people in recovery, and people doing the daily work of healing from trauma. These aren't our strangers, they are our neighbors, our co-workers, our family, and our friends. One of the greatest lessons this profession has taught me is that our job is not to fix people. People are far more capable than they've often been led to believe. Our role is to remove the barriers that make healing harder, whether that's stigma, transportation, childcare, cost, or simply not knowing where to turn. When those barriers begin to come down, people often discover strengths they already had. We also know that access to behavioral health care hasn't always been equitable. Black and brown communities have often carried a heavier burden while receiving less care, and that's not because the need is lower, but because the barriers have been higher. Providers are often scarcest in the neighborhoods that need them most. The mental health workforce still doesn't fully reflect the communities we serve, and too often BIPOC Americans are misdiagnosed, mislabeled, or even misunderstood. Distress interpreted as anger, grief mistaken for noncompliance, or a child needing support labeled as a behavior problem. There's a long history that has given many people reason to be cautious about who they trust with their health, and that caution did not come from nowhere. Rebuilding that trust is our responsibility and not theirs. That's why I'm especially proud of the team serving this community. Our behavioral health clinicians, Takia Arrington, Faith Benson, Gabrielle Washington, and Kaliat Gamba. These are the therapists you'll find here. We are all Black women in a profession where that level of representation is still uncommon. And that didn't happen by accident. It reflects our commitment to ensuring that the people we serve can also see themselves reflected in the people providing their care. And that my hope one day that this just simply feels ordinary. Health equity isn't about giving one group more than another. It's about making sure every person has a fair opportunity to achieve their best health. As therapists, we often talk about meeting people where they are. That means emotionally, but it also means where they live, where they work, and where they already feel a sense of belonging. None of this happens alone, however. Healthcare organizations can't build healthier communities by themselves, and community organizations can't meet every behavioral health need on their own. That's why this partnership matters. The Fort Wayne Urban League has been a cornerstone of this community for generations. By bringing behavioral health services into this trusted space, we're not just opening another office, we're building and bringing care to a place where relationships have already been built and already exist, and that trust is already there. Today we're cutting a ribbon, but what we're really opening is a door, one that's easier to walk through when someone needs help. If this partnership helps even one person find hope, healing, or simply the courage to ask for help, then this ribbon represents something far greater than a new office. It represents our shared commitment to a healthier and stronger Fort Wayne. And in true Alliance fashion, I would like to welcome all of our board members and our community partners. We have Parkview Health, Anthem, Rescue Mission, Paris House, Positive Resource Connection, Bridge of Grace, Fernstone, Iris Family Services, the Indiana State Department of Health, WindSwell, Urban League, Boys and Girls Club, and Inasmuch Ministries to please come up and help us cut the ribbon. We thank you all for being here. Please come up.
Bonnie.
Okay.
Bonnie.
Okay. I'm not gonna. Yeah.
Alrighty, everybody. Dr. Dowse is going to cut the ribbon. And 3, 2, 1. And with that, we'd like to invite everybody inside to come for a tour. Come see the clinic. We have refreshments. Oh. Stop it.
I'm going to jump on the trampoline.
So you have to sign a waiver for that.
Oh, or the sitting.
That's so cool.
Yeah, so we'll have to.
This is pretty cool. They got a spot for
Hang on, Mom. Try and wait for.
I'm doing good.
Hey, Ronnie.
Good to see you.
Yeah?
Can you take?
Yeah. Come in this one. Oh, it's dark. That was dark. That one's dark. Is this one?
Nope, we need the whole tour. Sorry, it's not complete.
Yes. Yeah.
I think we
Yeah.
Ooh.
I'm your administrative intern.
Okay, very good.
Yes, very exciting.
Careful. Oh, my goodness.
Yeah. I didn't see it there.
Oh.
Snuck up on you.
Yeah, it did.
Oh, it's an automatic.
Yeah.
You had your arm under there, didn't you?
Yeah.
Well, now you have a clean arm for the
Yeah,
rest of the day.
I do.
Okay, buddy.
Had Alliance help with them.
I've had some doors.
Nice to know where they are.
Sorry, I will. Go ahead, you guys will be able to come here.
Yes, of course you will.
And you guys just do handheld all the time, right?
Yeah.
And so for the phone ultrasounds, a little more.
I love that.
Oh, my position. Yeah.
I need to get that surface suit ready.
You know what?
Oh, this one right here.
I think I'm gonna do
I got this one. Uh-oh.
on this side, but if you're in that therapy room. Hey, I like your new office.
Thank you. It's not all put together yet,
Yeah, but
it's getting there.
More space is really nice.
Yeah. So I can see wheelchair users. That's my biggest thing.
Sue has one
Before my other office was cool, just now. But this is speech therapy room, so this is going to be
I think so. I think Dr. Suko says she's going to use the area.
Okay.
What are the kids stuff in those rooms? Are those more therapy rooms?
Yes, those are speech and maybe occupational therapy. So I don't know if they have all their stuff set up yet, but yeah. This sign is actually incorrect. It's not a staff lounge.
I didn't get lounge.
Good, how are you?
Good. Good. Very good.
We make sure.
But you did that right.
Yeah, but we're supposed to do another one.
Around the page of our boss, and I mean, you know, so
I gotta phone around and take one.
you have a good day. Safe travels.
Thank you.
back.
Just a time.
Neither of your kids looking amazing.
No, can you make that even
All
better?
right, right here, 1, 2, 3, hold it still, and 1, 2, 3, great. Great. One more.
The last minute with some of this stuff?
Hey, one more.
Thank you.
Thank you.
Thank you.
Great job.
Nice job.
Good job.
We're gonna need a special drill.
Good
to see you. Thank you.
buses are here for the school year.
So make sure you think, slow down for the blink. When the sign goes out, don't move about. Please stop your heart.
This message is brought to you by the City of Burnsville. For more information about traffic laws and bus safety, please visit www.burnsville.org/traffic.
Each school year, there are more than 15 million stop arm violations. It has to stop.
Stop for me.
It has to stop.
Stop for me.
We need your help to make a difference and keep our kids safe. Slow, stop, stay. Slow.
Slow for me.
Stop.
Stop for me.
Stay.
Stay for me.
Slow, stop, stay.
For us.
That you travel on, there's one day here and the next day gone. Sometimes you bend, sometimes you stand, sometimes you turn your back to the wind. There's a world outside every darkened door where blues won't haunt you anymore, where the brave are free and lovers soar. Come ride with me to the distant shore. We won't hesitate to break down the garden gate. There's not much time left today. Life is a highway, I wanna ride it all night long. If you're going my way, well, I wanna drive it all night long. Through all these cities and all these towns, it's in my blood and it's all around. I love you now like I loved you then. This is the road and these are the hands. Come on, St. B to those Memphis
Happy trails to you till we meet again.
You were watching Wesley's TV.
Happy trails.